individuals from making personal health care decisions, and then we've heard a lot about how important that is, and ceding those decisions to government bureaucrats is really the violation of fundamental human rights. And one must acknowledge that inherent in President Obama's statement that if you like your health plan, you can keep it, was that recognition of that human right to make your personal choices. I mean, that's why he said that, because he knew that's what we want. We want to be able to choose our health plans. But that was a lie, and he told that lie because he wanted to get his Obamacare, ACA, whatever you want to call it, plan out there. Which is interesting to me because repeatedly I've heard colleagues across the aisle say today, the system is broken. This is the system you designed. This is the ACA. We're all living under it now, one way or the other. It's your system.
One of Obama's biggest cheerleaders during his occupation of the White House is now whining about Barack and his colossal health care blunder. David Axelrod, the chief strategist for Barack Obama's presidential campaigns and former senior advisor to the president, is now venting about the Unaffordable Care Act. Taking to Twitter, Axelrod writes, "I've been taking a prescription for a chronic condition for years. This week, I learned my insurance no longer covers it. Now the cost is $639 a month. How many people can afford that? Your money or your life is a hell of a choice that people shouldn't have to face." Of course, Axelrod is now drawing a sizable paycheck over the bastion of fake news, acting as the senior political commentator at CNN. For us, the rest of us, that is, the expenses are associated with Obamacare are simply unsustainable. Take a look at this graphic. The average family health insurance premium in the U.S. has more than tripled since the Affordable Care Act was signed back into law in 2010. The biggest beneficiaries, health insurers. Millions of people are being forced to choose between medicine and other essentials, all thanks to the Unaffordable Care Act. Joining us now, representing Arizona's 5th, Congressman Andy Biggs. Congressman, thanks for coming on. You know, Obamacare has been a total disaster since its inception, and now the Democrats, they know it, they have known it, and they still know it. Are they simply playing the long game in their push to socialize medicine?
Dana, that's exactly right. When we sat in that hearing, which, by the way, was designed to set forth the path to have Medicare for all, they all talked about how broken the system is. It's terrible, it's awful. Because it is terrible and awful, because that's what happens when government gets involved in anything. And their purpose is they want a single-payer system, they want Medicare for all, and they want to go impose that upon you and take away your choices and your ability to design your own health care coverage and plan. And that's exactly the opposite of what we should be doing.
So Obama's appearance comes as Biden is set to take additional executive actions to expand Obamacare. What can we actually expect as a result of these changes?
Well, you're going to expect some more supposed cost-cutting measures. What they're going to do is they're going to cap expenses for certain areas, maybe in the pharmaceutical industry or other areas. But when they do that, what they do is two things. Number one, they make the premiums go up for everybody else, even within the system itself, the ACA system, the people who buy those plans. And the second thing they do is they stop innovation for drugs and medical treatments that we all want and need, and we want to see a cure for cancer, et cetera. That is what they're going to do. They're going to make your health care more expensive. They're going to make it harder to get to, and they're going to make it rarer and more scarce.
Low-income Americans, they can sign up for Obamacare plans with a $0 premiums on the federal exchange. That's just going to raise rates for the rest of us, it seems.
Well, that's true, because what's going to happen is the insurance companies they have to find some way to eat this, and so the way they do it, they jack up our premiums. And even though, so the private insurance companies are going to get more expensive. That means that employers are going to push some of their employees off if they can, and try to shunt them over to the state system, the government system. But in the government system, when they tell you that it doesn't have a cost, that's not true either, because that imposes a cost to all of us. And the number one cost is going to be an increase in the national debt, because we don't have the money to pay for all that free, so-called free coverage.
right? And we're already in the trillions. I mean, how much more higher can we go? I want to switch gears here because I think the two are intertwined. Biden's reckless border policies, he's stripping away a Title 42. They've allowed 2 million migrants to come through. Scrapping that title will supercharge the flow of migrants, illegal migrants. I predict we'll see an uptick, Congressman, and more drug seizures and human/sex trafficking to take place. And if you just look at the fentanyl epidemic alone, but then, having migrants come in and then they're going to, some of them going to go get free health care and reap the benefits of what it means to be an American. Did the Biden administration even consider all this when wanting to scrap Title 42?
No, none of that comes into play because the number one thing for them is they want open borders for two reasons. Number one, they hate the sovereignty of a United States of America. So they hate that, so they get rid of the border. The second thing is they're actually importing people that they think are going to vote. So you're right. These people are going to come in, they're going to get benefits, welfare benefits, because they're scrapping any eligibility prohibitions on there. Which we used to be able to, if you were taking state benefits, we could send you back out of the country. You were deportable. Not anymore under this plan, that's for sure. And you're right again on the numbers, because I calculate a little over 2.2 million, maybe closer to 2.5, somewhere in there came in illegally last year. This year, just take March as your barometer. Half of the people who were interdicted at our border were sent back due to Title 42. That's not going to happen again. That means you're going to have incentives, and I would guess you're going to be north of 4 million people entering the country in this coming fiscal year, this calendar year.
It's remarkable because, Title 42 was the last thing to stem the flow of the migrants. Now Biden, of course, getting rid of it. Well, shocker. 3 Republican states are suing the Biden admin because of Title 42 going away. And Congressman, some of these states don't even touch the border. I'm sure it was Missouri is one of them, Louisiana another. But now every state is considered a border state based off these catastrophic figures, like the ones that you just listed, and the ones from the CBP and the DHS, the ones that we see every day. Why do you think those states that aren't even attached to the border, what are they most worried about?
They're worried about because what's happening is all these people are being flown all over the country. So if you have 120,000 people, 100,000, whatever it was in March that we'll find out when they release the numbers, they were sent all over the country, wherever they wanted to go. So that's point one. Point two is the fentanyl and other drugs that are coming in are monumental in just the sheer volume. And we're seeing more and more people. Right now, 18 to 45, the number one killer is fentanyl and opioid overdoses. And that is just pouring across our border. Quite frankly, the Tucson sector is the most porous for drugs. And so you're just going to see this over and over again. So if you live in Louisiana, Missouri, Maine, Wisconsin, whatever, you are concerned both because you're getting people that have no nexus to your community. They're just coming into your community. And you're going to have to provide the services for them. And number two, the drugs that are filtering in and flowing in like water.
Yep. Well, I'm not sure, but Biden better have a plan to tackle that one, because the way these numbers, Congressman, keep going up and up and up, they better have something, because I don't think they're expected for what's going to happen next. Congressman,
right.
Thanks for coming on.
Not ready. They're not ready.
No,
Thanks,
they aren't.
Dana.
And I don't know if they'll ever will be. We'll see. Congressman, thanks so much for coming on the show today.
Thank you.